Hello everyone, welcome to the Health Hub Show, and as usual, I'm your host Nyambura KAMAU. So today we will be having an amazing session. But before that, I want to thank DreamWorks Investment Limited Company, who are our sponsors for our show today. And I want to remind you that they offer the best architectural designs, project plan management, and interior design as well. So don't miss out on your investment and don't miss out on your design. So anytime you need to build something, anytime you need an innovation, they are here for you, and you can get their contact just down below. So karibu sana to our session.
Asante sana.
We would like to know your name and what you do.
Okay, my name is Simon Njoroge. I'm a dietitian. Yeah, so I use diet as part of remedy in management of conditions. Yeah.
Okay, thank you very much. Now, today we have a very sensitive session ambayo inahusu watoto. And mostly ni imekuwa common kwa watu wengi. We will be talking about pneumonia. Can you tell us more about pneumonia?
So pneumonia is a condition of the lungs. Usually, it's an inflammation of the lung, small tissues called alveoli or air sacs, which usually is caused by different microorganisms. It can be viral or bacterial, or as a result of fungal infections. So pneumonia, viral pneumonia is the most tricky one, caused by strep, and it is a fatal condition, so can cause death easily if not managed. Yeah.
Wow. So what are the common causes of pneumonia in children?
Yeah, so as I've mentioned, it can be caused by viral, mostly streptococcus is the commonest virus. Not strep is a bacteria. It's the most common bacteria that causes pneumonia. It can be as a cause of viral, mostly respiratory cytomegalovirus, or measles can cause that. We have rhinovirus, which is usually the most common virus that causes common cold in children and elderly people. It can be as a cause of fungal infection. Yeah.
So parents out there or guardians out there, what should they be aware of? Unajua kuna mtu anaonanga fever ama anaona kahoma anadhani ni pneumonia.
So for the signs, pneumonia has very many signs, but there are those common signs or unique signs that can enable a parent out there to act swiftly if you realize that your child has such signs. One of them is a cough or difficulty in breathing. We said that pneumonia is an inflammation of lung small tissues called alveoli or air sacs. So if there is an inflammation there will be difficulty in breathing. So one main issue that should be an alarm to the parent is if your child has difficulty in breathing. The other signs includes inability to feed or breastfeed if a baby is breastfeeding. We have fevers, we have chills, we have nausea and vomiting, among many other signs. So if we try and classify pneumonia down to its different categories, different types of pneumonia have different cardinal signs. For example, if we say a child has severe pneumonia, definitely they will have difficulty in breathing or a cough which might be productive or non-productive. Kusema hivyo namaanisha inaweza kuwa inatoa kikohozi ama haitoi. Then we have any of the following signs. The child would be very much alert. The child might be unable to breastfeed or feed. They may have oxygen desaturation. So oxygen is going below the level of 90. Yeah. So for this child with severe pneumonia, they have to be admitted had managed in inpatient. The one main management of this child is supportive management. I think when we talk about management, we go further to understand the supportive management part of it. Then the second category of pneumonia is non-severe pneumonia. When we categorize a child has non-severe pneumonia, this child won't, they will be somehow alert. They will have a lower chest wall indrawing now because of the chest muscles they are trying to compress further so that they can try and have more oxygen coming in. So they will have lower chest wall indrawing. They might be somehow alert, but they'll have other signs like vomiting, the fevers, and the rest. So for these ones, they still be managed as inpatient. Then we have the third category of non-pneumonia. This non-pneumonia category, it's actually the common cold, which is usually common here around, especially when the weather changes. People have running nose, they have the cough. Yeah, so for these ones, they are managed as a patient and with close monitoring so that they may not progress to non-severe or severe pneumonia.
Oh, okay. Speaking of severe or non-severe, who are at a higher risk of getting pneumonia?
So severe and non-severe both are pneumonia. Those people, those categories of people that are at risk of getting pneumonia are those who are immunocompromised. Talk of people with diseases which are long-lasting, like diabetes.
Even to a child, especially to a child.
Even to adults, especially 65 years and above. For babies, when we say about immunocompromised, are those people who are exposed to HIV, child who have delayed milestones or have other congenital anomalies. They are born with anomalies. Yeah.
Okay, because I have seen a child, maybe the child was born before the actual time of birth, an incubated child. So what are the chances, like anakuanga mgonjwa sana hizo attacks? Is it one of the risks ama ni juu hakupata hiyo chance ya kubuild immune?
For immunity, we say there are two types. There is the acquired one and there is innate one, the one which we are born with. So underweight babies, those who have raised weight, and those who are born before their due dates, they are actually at risk of this condition. Yeah.
So what treatment options are available for children who have pneumonia?
For the treatment options, actually it depends with the severity of the pneumonia.
Okay.
So if it's severe pneumonia, we have to admit that child. We have to give medication via IV access, and then we support through feeding, through hydration, and if it's non-severe pneumonia, still admission, IV access. For non-severe, we give oral medication, then we cross monitor when the child they are at home.
So how do you diagnose it? Like mtoto amefika, how do you rate it? By kuangalia ama there are some special tests?
For the diagnosis, there are different ways we can diagnose with a patient with pneumonia. So we can use clinical diagnosis, which is now we check on for example, the severe pneumonia, the child will have a cough and difficulty in breathing. Then we check on oxygen saturation. If it's less than 90, it brings a concern. We check whether the child is able to feed or breastfeed. If they are not able, it gives us a way to make a diagnosis. Then if we check the chest rise, in drawing, usually the chest rises in a good pattern. So if the pattern of the chest is not, there is an indrawing, we can make a clinical diagnosis of the same. If not, now the clinical, we can go to the lab. We can do blood test, hemogram to assess the rate of bacterial infection. We can do inflammation markers, those tests, or we can do even a chest X-ray to be sure.
Okay. On behalf of first-time mothers, when a child, maybe nimekuwa late kurecognize like mtoto wangu akona those high symptoms and imefika point like ameanza converse ama ameanza fever imepanda ama ameshindwa kupumua, what is the first take I should do before nimpeleke hosi, like before ni rush out? But before we get that answer, I want to remind everyone out there that DreamWorks Investment Limited Company, they are here for you and they got you covered. That plan you have or that idea you want to apply in your own house or your building, they will make it a reality. Yani, they are turning dreams into realities. So don't hesitate. Now, if you need a proper planning, if you need a proper management of your properties, they are here for you and they will get you sorted. Kama ni big buildings, ama mansions, ama anything you might need, they are here for you. We are just going for a short break. Do not leave because we need to learn more on pneumonia.